Friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. And you can also visit the playlist where the topics so far we have covered has been given in a systematic order. So it is quite convenient for your study purpose. My dear friends, as usual, today we will discuss about one of the very important topic in Kamarvartya or in pediatrics, which is pertaining to the childhood practice, that is autism. Autism is becoming very common nowadays because of various reasons. Probably in olden days also autism was there, but there was no precise diagnosis of autism, and nowadays we are very akin to the diagnosis of autism. Therefore the autism cases have been well diagnosed nowadays, and that may be one of the reasons for increasing the incidence of this autism. However, there are so many other factors including lifestyle changes, personality changes, and changing in the family environment, and so many other factors, working mothers, etc. So which is also one of the major cause of autism nowadays, that we will discuss in later part of the presentation. Today we will discuss about the basics of autism. When I say autism spectrum disorders, autism and autism spectrum disorders, so there are autism spectrum disorders means there are so many other disorders also which are almost all having similar symptoms of autism, but exactly not fulfilling all the criteria of autism. And those disorders are in total, they are included under autism spectrum disorders. Now, autism spectrum disorders mainly include three important disorders. Number one is autism, number two is Asperger's syndrome, and number three is Rett syndrome. In this Rett syndrome, which is very common in female or only seen in female. Anyway, so when I say autism spectrum disorder, it is not a single disorder, rather it is a spectrum. Now, when we talk about autism, there is no much difference between male and female. There is no female and male differentiation. Both the genders are equally get affected. But when you look into the cases of autism in the adult life, mostly the males are more affected. We exactly don't know what is the reason for this. In adult life, when we take the percentage of autism, we find more males rather than the females. Whereas in the childhood practice, there is no such differentiation. Male and female are both equally get affected. Now, what actually autism is? Autism is one of the neurodevelopmental and behavioral disorders in children. When I say neurodevelopmental, so this is something related to the development. So development of the social milestones, development of the language milestones, to some extent the development of cognition milestones. However, the language and social milestones, these are the two important issues which is greatly affected. Along with the neurodevelopmental, there is also involvement of the neurons, and also as a result there is a affliction in the developmental process. And also behavioral disorders, it is something also related to behavior. We find a different type of behavior of the child. So autism spectrum disorders are neurodevelopmental and as well as neurobehavioral disorders. Okay, both will be seen. Development is also get affected, and also behavior of the child is also get affected. So exactly in case of autism, it is characterized by an age inappropriate social, communication, emotional, cognition, and adaptive abilities. So basically, when you are talking, these are the important domains which are get affected. The child is having a lot of problem with attaining the social developmental milestones. Child will have a lot of problem with the communication. Child will also have a lot of problem in the expression of the emotional aspects. There is also affliction of the cognition and also adaptive abilities. So this is communication, emotional, cognition, and adaptive abilities, and social. Out of these two, communication is nothing but language, something related to language only, verbal and non-verbal languages. So social and language, these are the two major important domains which are get affected, and other three are also get affected because The cognition, adoption, and its emotional aspect, this is depends upon the social and communication developmental milestones. If these developmental milestones are properly developed, then it also aids to cognition and adaptive abilities. So as they are get affected, naturally the cognition and adaptive skills are also affected. That we will see in the coming classes. We know that neuro means it's the CNS is affected. Development and behavior is also affected. So this leads to significant functional impairment. So when there is affliction of the social, communication, emotional, cognition and adaptive abilities, that leads to significant functional impairment in the individual. All the other developmental milestones are normal except social and language. This is a basic thing. Of course, in some of the cases, even the cognition and adaptive abilities are also greatly affected. But otherwise, in maximum, the autism cases will have affliction of the two important developmental domains, that is social and as well as language. Exactly what is the pathology? In short, to say one word, if you remember, in case of autism is he is cut off from the world. He is cut off from the world. That means he is not connected with this world. What I mean to say is we are actually connected with this world through the sensory impulses, isn't it? We have a touch, we have auditory sensation, we have got olfactory sensation, then taste perception, then we have got visual perceptions, okay, touch perception. So there are so many important issues. Va gati gandhanayor, when we say va gati gandhanayor, the definition of the vata, so gati refers to motor activities, whereas the gandhanayor refers to sensory aspects, okay, sensory gandhanayor, perception. So these are the two important things upon which our nervous system actually work, okay. But the problem is the sensory cutoff is there. That means the sensation which is present in this universe is not perceived by the baby at all, okay. So we know that two important sensations is visual sensation and as well as auditory sensation. Visual and auditory sensation, so they play a major role. Apart from that, proprioceptive perception is there, crude touch, crude pain sensation, etc. Many proprioceptive receptors are also there. But in case of autism, actually what happens is he is not able to understand actually what you are telling, okay. So therefore he will have a lot of problem with the language and communication. So you have got language and communication problem, so he is not able to receive the sensory inputs. When the sensory inputs are not received, these sensory inputs are not carried to the hypothalamus and then to the cortex, and cortex is not able to give any response for that in the form of the motor impulse to the same. Now suppose if I call the name of the child, now if the child is listening and if the child is understanding what actually has been asked, what is your name, when I ask, if the child is able to listen and understand what actually the question is asked, then he is able to answer that question. The problem with the autism is he may listen or he may not listen. If he listen also, he is not able to make the meaning out of it. Okay, he is listening some sound, he is appreciating some of the sound, okay, in the form of the sound waves. But actually what is exactly asked he is not able to understand, because that impulse is not reached the sensory cortex or hypothalamus, then it is not reached the sensory cortex, and then as a result the response has been not created. So when you don't understand what has been asked, then how you can answer? So this is actually happening in case of autism. Autism, what you're asking child is not able to understand, or he is not extract the meaning out of it. Therefore he is cut off from the world. So as he is not understanding anything what you are asking, so he will not answer, or he will not give any response to your questions. So this is a basic problem. In one word to say, we can say he is cut off from the world. That means his motor activities are good, but motor activities are always related to the sensory aspects, isn't it? Whenever I touch the heat, by heat sensation I will take away my hand, withdraw my hand. So depending upon the sensory stimulus, my motor activity is there. The problem is this particular sensory stimulus is not itself going inside, or if it is going also, it is not able to extract the meaning out of it. That means sensory cortex is not working. Before that hypothalamus is there, then later sensory cortex is not properly working, and as a result there is no motor response. But many times baby play himself. Therefore, he is cut off from this world. So what he will say, he will create his own world. He will create his own parameters and words, and there only he is playing. Okay, so therefore sometimes he is talking irrelevantly, sometimes he is talking irrelevantly, sometimes he is playing alone, because he is not able to appreciate what others are doing. So this is a basic problem to in short, basic problem short in short about the autism. Details we will see in the coming classes. So in the next class again we will look into the some other aspects of the autism. Thank you very much for being with me, and we will continue the same in